Insomnia is a medical term, but it's the proper, that it's a lack of sleep, actually, lack of sleep, in layman's term. And in insomnia, there are some diagnostic categories, like if the patient is having problem of initiating sleep or maintaining sleep for a particular period of time. Say, in the diagnostic category, they say that if you have got sleeplessness in at least 3 nights per week and persisting for at least 3 months. So we can call it insomnia. It's a lack of sleep, but sleep means sleep has got these problems, like lack of initiation of sleep, lack of maintenance of sleep, and if you experience early morning arousal, then you are having insomnia. It varies from person to person, but some persons are quite comfortable of like having 5 to 5.5 hours of sleep, and some persons are comfortable, like say 9 to 10 hours. Insomnia is a diagnosis per se, but the underlying factors may be multifold. They may be multifaceted. Like say insomnia, there may be some 1/3 of the insomnia causation we don't know, because that this is called idiopathic. And idiopathic means the causes are not really known. The patient is having insomnia, but we don't know. But in the rest 2/3 of the patients, we are having insomnia, in the patients of medical problems as well as psychiatric problems. In the medical problems, if the patient has got like chronic illnesses. Say the patient is having chronic obstructive pulmonary disease. Like say if the patient is having respiratory problem, if the patient is having any problems like painful condition, if the patient is having some kind of tumor or like that in cancerous condition, then obviously the medical agony and the medical pain will cause insomnia. And the psychiatric conditions, we know that the most common should be depression, because in the depressed patients, the insomnia is the commonest symptom which you encounter. Other than depression, there are some other disorders like anxiety problems, schizophrenia. There's a lot of mental problems which can cause insomnia. We have to inform the patient about these things and then treat accordingly, because insomnia is the diagnosis of exclusion, because insomnia is there, but it's the tip of the iceberg. We must have some kind of underlying disorders which we should identify and diagnose. Insomnia has got a specific diagnostic category, like say if the patient is having 3 nights of sleeplessness per week for 3 months, this is insomnia. But if the patient has got these are not satisfactorily met, these criteria are not satisfactorily met, then probably it's temporary. Say the patient is having some kind of stress, momentary stress, then the patient can have got sleeplessness for quite a few days, like 7 days. And if the patient suppose encountered a road traffic accident, and then he has got a pain, which will say relief after orthopedic attention, say after 1 week or 2 weeks, and due to the pain, the patient is not having proper sound sleep, we can tell the patient that it's not a patient of insomnia, but obviously it's like temporary sleep disorder, because it is not meeting that diagnostic criteria which has already been stated and identified. There are multiple pharmacological treatment as well as non-pharmacological treatment. I think I should tell about the sleep hygiene over here. Try to maintain a good sleep. Stopping insomnia means treating insomnia. That means we have to prevent the causes which are there. If we identify the underlying medical or psychiatric disorders, then obviously we should treat it by drugs, by medicine. If it is idiopathic, if the causation or the factors are not really known, then we have to tell the patient that improve your sleep hygiene. And what is sleep hygiene? Sleep hygiene means just maintaining some kind of daily life activities, so that you can have a good sleep. Like if you have a proper diet in the dinner, you are avoiding rich and spicy food. If you are wearing a light dress, if you avoid seeing laptops or mobiles at night, if you have got regular proper exercise daily, and if you avoid caffeine like coffee or tea or alcohol after evening, so these are the and if you avoid daytime naps, okay, and if you like say if you don't use your bed apart from sleeping, like if you don't really there are often some kinds of problems that people often relax over their bed, but it's not like that. You just use your bed at night only during sleep. So these are some behavioral interventions which we can offer to the patients, that just try these before going into medication. So stopping insomnia means treating insomnia first, to offer them these kind of sleep hygiene. And if after sleep hygiene advice, if the patients are not having relief, then we should go for the medication. Insomnia, the treatment is definitely a lengthy one, because obviously if the underlying factors are a little bit difficult to treat, like say if the patient is having a long-standing depression, or say if the patient is having lots of painful condition, like in case of medical disorder. So then obviously insomnia should go hand in hand with the cure, with the care or cure for the conditions underlying. So definitely we should go for a long treatment, probably 6 months to 1 year, and then we have to taper down the dosage of the medication. We have to psychoeducate the patients that you identify your sleeping time and like that. Then we should go for that. So in a nutshell, it shouldn't be answered in a single sentence, because there are multiple factors which come into play. So probably we should prepare for a longer treatment. Medical disorders are obviously very important, like these chronic pain conditions and cancerous conditions, and like asthma, pulmonary disorders, which are disturbing your sleep in a physical way, in a medical way. That are the medical conditions. And for the psychiatric illnesses, as I have stated, that depression is the commonest, followed by schizophrenia, bipolar disorder, anxiety disorders, and all. So a treating physician should identify what are the causes underneath the insomnia. Patient will tell you that I am having, I am not having refreshing sleep. But what lies beneath, we have to identify that. Whatever that is, it idiopathic? Is the cause is the cause is unknown? Or if the cause is known, what are those? What are those? We have to identify. Patients who are having these disorders, which I have said earlier, medical or psychiatric. Apart from that, if the patient is having an irregular lifestyle, and if the patient's sleep-wake cycle is disturbed from the very beginning, then it would be disturbing. And elderly people, because in the circadian rhythm, in the body's biological clock, it's a little bit goes into disarray when the age advances. So definitely after say 60 years, 65 years, the sleep-wake cycle is a little bit disturbed. We often see that the elderly patients, like in their 60s or 70s, they often wake up earlier from their bed, because the degenerative process in the brain has already started in. So there is a problem. So age is a factor, stress is a factor, lifestyle is a factor. So obviously these are the and definitely other illnesses, medical or psychiatric illnesses are the factors which are responsible for income. When it jeopardizes the patient's normal life, when the patient isn't having refreshing sleep, then obviously his daily life isn't going smooth. The daily life is impaired. Obviously, the patient cannot concentrate on his work. He gets easily tired. His quality of work falls. So all the things that come into play. If the patient is not having, when the person is not having adequate amount of sleep which is required for him or her,